Health has got such a proud heritage in Scotland. We're a cornerstone supplier to many of the health boards. And so for me, this is about how do we go further? What about extending this into patients themselves? How do we help them and their carers become stakeholders in the digital shared care record in Scotland? But also, how do we go faster and be more nimble to help the innovations that we're seeing across the world make it to the front line of the health and care organisations quicker?
A conversation we just had was around the ambulance service, potentially accessing some of the key clinical data on mobile phones, for example. So all of these conversations are quite exciting with how we're actually going to move things forward in Scotland.
10 years ago, clinical portals were the way healthcare was going to leap forward in terms of capability. Digital front door is the next big one. I suppose the challenge is that lots of suppliers come with their offerings to Scotland. Orion have done the same, but I think we still need to understand how it's going to actually work on the ground, because you can't have 10 apps that do the same thing. You've got to have one good one. But the potential once you've got that is so great. So hopefully Orion can embrace that feedback that we've given today and do something positive for us.
From a Orion perspective, we have a product we call the digital front door. The aim of the digital front door is to automate every interaction that the patient has with the healthcare system as much as you can to enable these interactions to be more productive, better, faster, cheaper. We're talking about the digital front door and the things we've had with it at other sites, and then we're looking to see in Scotland whether there's enough interest and whether that's something that the time is right for that in Scotland now.
I'm really keen to look at an aggregated allergy view as well, so that we have primary care, secondary care and community information all being available, and also starting to work with our contractors, our private contractors like community pharmacy, optometrists, etc., so that we can really share that information out. And the digital front door, and engaging with patients and allowing them to access their own information, book appointments, all of that type of thing.
I think for the work that we're doing here in the Jubilee, I think, for example, on the immediate discharge letter, there's the little windows that were shown on the latest version is going to be a massive benefit. For example, checking the results for patients while still being in patient records and being able to carry out our tasks. I think, especially for our clinicians, that's going to be a massive benefit for them. So if we can get that implemented as soon as possible, I think there'll be a lot of happy faces.
I look at Orion as one global company that makes the life of every patient, which could be me or you or somebody else or one of your family members, better. And when I see that we've got products that customers are excited about to deploy, to use in their hospitals, to make things better, I think that was my highlight for today, knowing that we've got something great that people are willing to take on.